Daniel never thought of himself as someone with an addiction. He didn't drink much, never touched hard drugs, and always told his friends he was in control. But every morning started the same way, with smoke. At first it was just to take the edge off after a long day. Then it became the only way he could eat, the only way he could sleep, and eventually the only way he could even get out of bed. His girlfriend noticed before he did. He missed dinners. He stopped finishing projects. He forgot conversations they had just the day before. When she asked him about it, he brushed her off. "It's just weed. Everyone does it. I can stop whenever I want." But when he actually tried to stop, his body told him a different story. Anxiety hit like a wall. His appetite vanished. Nights turned into long hours of staring at the ceiling, wide awake, craving relief. That was the moment Daniel realized something terrifying. He wasn't choosing anymore. Cannabis was choosing for him. This is the reality of cannabis use disorder. It is a condition that quietly affects millions of people. But most don't believe it can touch them, until it does. What is cannabis use disorder? Cannabis use disorder, or CUD, is defined in the DSM-5 as a problematic pattern of cannabis use that leads to distress or impairment. To be diagnosed, at least 2 symptoms have to be present within a 12-month period. These can include using more than intended, unsuccessful attempts to cut down, craving, spending too much time using or recovering from use, failing to meet responsibilities, giving up important activities, and experiencing withdrawal when trying to stop. For Daniel, almost every box was checked. Here is what is happening inside the brain. The main psychoactive compound in cannabis, THC, activates the brain's reward system by flooding it with dopamine. At first, this creates feelings of relaxation, pleasure, or creativity. But over time, the brain adjusts. It begins to rely on cannabis for that dopamine surge. Everyday pleasures, exercise, friendships, achievements, feel dull. Tolerance develops, which means you need more to get the same effect. And when you try to quit, withdrawal symptoms show up. Irritability, anxiety, insomnia, loss of appetite, sweating, and powerful cravings. This cycle makes stopping feel almost impossible without support. How common is it? Contrary to popular belief, cannabis is addictive. Research shows that about 30% of cannabis users may develop cannabis use disorder, and the risk is much higher if use begins in adolescence. People who start before the age of 18 are up to 7 times more likely to develop CUD. Today, with stronger high-potency products on the market, the risk is even greater. The impact beyond the high Daniel's work suffered because he struggled with memory and focus. He forgot deadlines and missed meetings. His motivation dropped to 0. He stopped drawing, a passion he once loved. His relationship grew tense, filled with broken promises. And emotionally, he felt trapped between the temporary relief of smoking and the shame of knowing it was controlling his life. Studies show that long-term heavy cannabis use can impair memory and concentration, lower educational and career achievement, and increase the risk of mental health problems such as anxiety, depression, and even psychosis in vulnerable individuals. Physically, smoking cannabis regularly can affect the lungs, raise heart risks, and worsen sleep problems. Hold, musical breath to prepare shift to recovery. The good news is that recovery is possible. While there are no medications specifically approved for cannabis use disorder yet, several evidence-based therapies are effective. Cognitive behavioral therapy helps people identify the thoughts and triggers that fuel use. Motivational enhancement therapy helps strengthen the personal reasons for change. Contingency management offers rewards for staying substance-free. And support groups such as Marijuana Anonymous provide community and accountability. For Daniel, reaching out to a therapist was the turning point. At first, he resisted, convinced he could quit on his own. But after another failed attempt and another sleepless week, he admitted he needed help. Therapy gave him strategies to handle cravings and structure his days. With support, he slowly rebuilt his routines, rediscovering the joy of drawing, reconnecting with his girlfriend, and learning how to relax without relying on cannabis. If someone you know may be struggling, the best thing you can do is approach them with understanding, not judgment. Many people minimize their use or deny there is a problem, so patience is essential. Share information about cannabis use disorder. Encourage them to talk to a healthcare provider. Offer to support them in finding therapy or attending meetings. Small gestures like listening without criticism can help reduce shame and open the door to change. Daniel's story could have gone differently, but by recognizing cannabis use disorder for what it was, a medical condition, not a weakness, he was able to reclaim his life. He still has cravings sometimes, and recovery is ongoing, but he no longer wakes up every morning with cannabis controlling his choices. Cannabis use disorder is real, and it is more common than many people realize. But like other substance use disorders, it is treatable. With awareness, compassion, and support, people can recover and rebuild lives that feel whole again. If this video gave you value for your time, share it. Someone you know may be quietly fighting the same battle Daniel fought, and hearing this story might be the first step toward their own recovery.